Good evening, everyone. This is going to be the Laugh Fest Change of Shift podcast, episode number 11. We are talking body modifications on patients and providers. Tonight, I have Sonya Grenell, who is a tattoo artist.
Hello.
And James, who is a professional piercer. So, my co-host, Sean.
Welcome. Good evening, everyone. Thanks for tuning in.
Hey,
James,
Sean.
Sonya, how are you?
Hi.
Good.
So we are having, this is a bit of departure from what we've done so far on our podcast. We like to focus a lot of our energy on fellow nursing podcasters and medical podcasters / bloggers who are out and about in our world. But I've had a couple of things happen to me over the last couple of weeks, and amazingly enough, the stars aligned, and James and Sonya were both available this evening. So just a little bit of background. A couple of weeks ago, Sean, we were in the post show, and I had a fellow person here on Blab say something about being afraid of having the tattooed nurse take care of them. And that's the first time I've had any type of feedback like that. The second thing I've had happen to me is I brought a patient into the trauma bay who had multiple piercings, and most of the healthcare providers had no idea what questions to ask, what to do with them, and how to actually take care of them. So James, Sonya, I got a bunch of questions for the two of you. So, but before we get started, James, let's start with you. Could you give us a little bit about your background and your training, and what is it to be a professional? Is professional piercer what your title is?
I'm a professional piercer. I am also a body modification artist. So I also do scarification branding. I've been doing it since 1993 professionally. So yeah, I'd say that's legit.
Years of practice. So Sonya, tell us a little bit about your history.
I started tattooing when I was 20, and I was tattooing part-time after I was going to school. And after I graduated, I started tattooing full-time because I decided to do that instead of my degree.
And your degree is in?
Graphic design.
Yeah.
I have my bachelor's in graphic design.
I'd say that was a very good segue.
Yeah, for sure. It changed from hands-on to computers.
So just a little disclaimer, Sonya happens to also be one of my very, very good friends and my tattoo artist. So all of the ink I sport, I can actually say she's here. Most of the time people ask me who does it. And James is also a personal friend of mine as well. And he happens to be one of my husband's insane buddies. And they
got to use the word insane with that?
Yes.
What about adventure? Yes. Maybe adventurous. That'd be better. Oh.
Not so.
Okay.
Not so.
Okay.
Those kind of go hand in hand.
Yeah. and usually I get the pictures later, so oh yeah, James.
Whoa, you guys are down to audio only.
Okay, so that means when we are down to audio only that it's something with your connection. Okay. So if either of you have connection issues, you can X out and then come back into the show if it doesn't clear itself up.
We actually can hear you pretty good, James. So as long as you're okay with it, you can just stay right where you're at.
Yeah.
So.
And we still have your video as well. So first and foremost, let's talk about some just very basic things, and we'll kind of do a quick go through. A lot of times when I have people talking about getting pierced or getting tattooed, things run through my head related to issues with infection control, disease prevention, and those types of things. So I think the first thing that I'd like you two to talk about, if you would, is what kind of precautions that you guys take in being professionals, because you both, Sonya, you co-own your own shop. And James, I believe you co-own your own business too, or you own your own business?
Yep, I run the piercing segment out of a tattoo studio.
So this isn't just something where we're talking, you guys are definitely not scratchers. So what sets you apart from...
Wait, question in the back. What was that? Scratchers? What was that?
Scratcher Sonya, you want to answer that one?
It's somebody who does.
Say, I'm sorry. I'm thinking of a DJ. So I'm from the ghetto. So you gotta clarify.
It's somebody that does it out of their house or not in a licensed environment.
Understood. Thank you. Emily has to think about the audience as well as her co-host when she.
See, that's why I have my co-host.
Yeah.
He's on it.
Yeah. Yep, he is. He's been doing this for a while. So what does it take for you guys to be licensed in the state, and what kind of things should people consider if and when they are looking to get pierced or tattooed?
You want to take this one?
Ladies first.
Sorry, I actually didn't hear your question because Jesse walked in and I was telling him that dinner was done. Sorry.
The meat's done.
The meat's done.
So what differentiate you from a scratcher?
For me, it's that I actually have a crap ton of training. I know a lot of artists don't actually go to school, but I went to school for the design aspect about it. But as far as the health side, our studio gets inspected. We have to pay our licensing fees. We have to dispose of our needles the proper way. We have to make sure that everything is packaged and sterilized before we even use anything. And people at home aren't regulated, and you never know if their stuff is actually sterilized or not.
And what kind of equipment do you guys have to have and maintain at the shop?
We have, as far as like, we have to buy all of our needles. We have to clean all of our tubes. We have to maintain our machines and our power supplies. And we also have to make sure that our artists are actually doing their job well and not, I guess, like overworking everybody's skin and not being a good artist.
So James, let's the same question to you. What kind of stuff do you have to do as far as your equipment is concerned? What your needles, where you get your supplies from?
Well, most of my supplies I'm getting from my jewelry manufacturers. Everything that I run personally is run through a Statum, which is my primary sterilization source. Needles are all disposed. I don't use too many tools in my profession. Some piercers will use a lot of tools, some will not. So that's when a separate sterilization room is going to need to be provided. But the same, the state has us pay a licensing fee. They do the inspections. The legislation in Michigan is not where it should be. And I hate to say that, but yeah, I don't know where I want to go with all this.
Yeah.
So that brings up a question of my own.
It's a lot better.
So is it different in every state?
Yes.
Yeah.
Yes.
Who governs it?
It usually goes by state and then county.
Okay.
So
the county.
The state has different regulations than the counties do, and some counties are stricter than others, and some are more lenient. But even if somebody reports anonymously that somebody's doing it out of their house, it's really hard to even catch them. So that definitely needs a change.
And this is the health department? Is that who it is? Okay.
Yeah. Yep.
Yep. It's governed by the same food service in the state of Michigan.
Yeah.
Okay.
Which is weird, huh?
Yeah.
It's very strange.
Yeah.
Because what you do, and from my own experience, what you guys do, more about your equipment and sterilization than most healthcare providers. All I know is I get a package and I look for an expiration date and make sure that my package is not compromised in any way. You guys take that 3 or 4 steps further, which I find fascinating. In the tattoo places I've been in and different places I've been in for piercings, they're usually cleaner than a lot of doctors' offices, which I think says a lot for you guys because you know, you aren't regulated the same way. You are still very regulated, but not the same way. Sonya, I'm going to ask you a couple of questions about tattoos in particular. We're seeing a lot more patients with tattoos. I've had, unfortunately, I've known of some providers that would keep, oh God, I'm not even going to go here. We've had lots of interesting discussions about tattoos, especially on surgical patients.
Okay.
I'll leave it at that. Sean, you know where I'm going with that.
Could go two different directions on that one. So
yeah, okay.
How about could we rewind, or are you going to ask the question?
I'm going to ask the question.
Okay, ask the question.
What do we need to know in an emergency setting, in a surgical setting? You know, somebody pays thousands of dollars for their artwork. What are some of the things that you've seen that healthcare providers have done to your artwork?
They stitch it up wrong. They don't try to match up the lines, and I don't know, like that's one thing that really gets to me. If a few of my clients, they have spent well more than $1,000, went to the doctor, had to get a minor surgery, and then they would stitch it back together and not put the line properly together, even though it wasn't, it was a straight cut. And I don't see how the hell they couldn't do that. But that's one of them for sure.
So the lines, so it would be the line work is completely off and there's just no way to fix that, correct?
Yeah, there's no way to fix it at all. I mean, unless you want to cover that spot, but if it's off by a 1/4 inch, then you can't do anything about it. You just have to leave it that way. Unless it scars and then, you know, the ink comes out and then you can try to fix it, but it still doesn't look the same. It doesn't look right. It would seem like they would take a little bit more care into trying to put the skin back together the way that it came before the cut came, or even for minor surgeries too. I've seen that too. I had a guy that had to get shoulder surgery done, and it was a really tiny incision, but the stitches weren't put back properly, and now it's off by a 1/4 inch, and that's a whole sleeve, and it took 40 hours to get that one done, and now there's a little section of it that's completely off, and I can't do anything about it.
Now, do you think that would have been a conversation that he had, or did he have with his surgeon?
I actually probably ask him that. I'm not sure.
Because I'm wondering if he would have if you would have made the request to either avoid a certain area or go to a certain area. Because, I mean, from my knowledge and experience in surgery, there's only so many windows you can hit, depending on the injury.
But if it's the whole shoulder, I mean, the sleeve started from, you know, I'll try to show it from here all the way down. So if it's going into, you know, like there was 3 incisions, there was one here, here, and here. Mm-hmm. And the one in the front was probably about maybe an inch and a half long. And that one didn't measure back up.
Understood. So we have a question from the audience who's asking that, have you seen incisions done correctly?
Yes. There's actually one doctor up here in Big Rapids that I don't know his name or who he is or whatever, but I've seen a few of his stitches put back together, and he does an amazing job for sure. I've definitely seen that happen. But sometimes I don't know if it's that the doctors just don't give a shit about tattoos, or they don't like tattoos and they try to mess them up. I'm not sure. I don't know. That's what I've always been curious about that.
Yeah, I mean, I'd probably ask the individual, the patient, ask them, did they broach that subject with their surgeon, since if it was a planned surgery. If it was an emergent surgery, I don't think anybody can argue with, you got to cut them open and do what you have to do. But if it's an elective surgery, then maybe they could have had that conversation with their surgeon.
Yeah.
And I hate to say it, but then you also have to think in terms of, and Emily can attest to this, is that the person who does the surgery is not always the person who closes them up.
Oh, yeah. Okay.
So I work in a teaching hospital, and we have to learn somehow. So the lower leveled residents and, physicians who are training have to learn. So they usually give them those tasks. And quite honestly, we could, that person could have that conversation with their surgeon, but then the surgeon's not the one who closes them up. It's usually somebody else.
Oh, I got you.
Well, and sometimes too, it's luck of the draw with who you get in the trauma bay and or in the emergency room and or wherever else. And I've had these conversations working ortho with some of the surgeons that I worked with, and I've seen some of their stitch jobs and or staples, and it just infuriates me sometimes. So
for someone who has to suture people up, it is an art that you have to learn.
I'm sure.
So.
But speaking to two people who use probably more needles, Sean, than we will in 10 years. James, what are some of the new body modifications or less common body modifications that people are having done with implants? I know we're starting to see those a little bit more, dermals.
Surface anchors, surface piercings. Those are more that you can't remove and put back in. So say your doctor tells you have to take them out, you can't really just put them back in like an earring. So it's not the same type of piercing. It's made out of implant grade titanium for the most part.
So why would you have to take it out if it's made
exactly?
Out of
you don't have to.
That you're putting people back together with, like the same material that you're using for their pins. And
so do you know off the top of your head if it's radiologically safe?
It is. You can go through
MRIs.
Yes,
you're
fine.
Yeah.
The big thing that I keep seeing more and more of is most doctors keep saying that they want all jewelry out because they're worrying about if they have to use paddles that they're going to catch an arc somewhere. Mm-hmm. And that's the biggest complaint that I've heard recently. Most doctors are fine with letting you go through with anchors. Any piercer should be able to provide a material data sheet that you can take to your doctor and hand them and be like, this is what I have in my body. But you can't get it for everything. Like if you go to Hot Topic and you buy something, fail. You're not going to get that same nail cert you're getting from my studio.
Well, and that's part of the problem that we have. Like in my role as a flight nurse or anyone who's a paramedic or works in a trauma center, you get patients who come in who may or may not be conscious, number one. And number two, you're doing a body scan and pulling out every piece of metal you can find because you don't know what it's made out of.
I agree with that.
So I think that a lot of times having, at some point we need to start looking at standardization of certain things, but unfortunately we can't control what people put in their bodies. So, what if anything really should and needs to come out?
I would say sterling, silver, like butterfly back earrings, necklaces, bracelets. That's the kind of material. If it's body jewelry, it's probably going to be implant grade stainless steel or implant grade titanium, niobium, or even nickel free gold. If it's body jewelry and if it's good body jewelry. Normally you can tell by looking at jewelry if it's cheap or if it's good. At least I can because that's my job. So maybe I'm being naive with that one.
So Sean, answer this for me. What, other than an MRI and or films, what reason would we need to pull everything out?
So James is talking about implants, regardless if they're MRI safe. If we're doing surgery, and there was a comment in the Twitter feed that talked about nipple rings being ripped off if they went to surgery or something like that, and that's an extreme case. But you do have to consider fire in the OR. So we have something called a bovie. I don't know if James or Sonya know what a bovie is. It's a cautery tool, and what it does is that there's a foot plate for to ground you, and there is actually electric currents going through the patient's body. So if there's any kind of metal object on the patient, it can actually catch fire, not just electrocute you, the person who's giving them the electric cautery, but the patient can actually catch fire. And it's a safety video that all operating room nurses, staff have to watch is that when you use a Bovie, if there's any metal on the body, there is a potential for actually causing an explosion. So
Sweet.
that would be why that would be a cause for having to remove an implant that is thousands of dollars, is that you potentially you have no guarantee of not causing a fire, so you have to remove it.
So when you're removing it, does the doctors or whoever is there to remove it know how to remove it?
Probably not. So but I guess we'd have to start talking about emergent surgery versus elective surgery again.
Yeah.
So in emergent surgery, let's be honest, if there's implants in certain parts of the body that they're not operating on, they may not even know it's there, and you'd be fine. But there have been instances where implants or metal in people's bodies somewhere underneath their skin, and it's happened in trauma patients who are in a car accident and then have metal shards in their body somewhere that didn't get cleaned out before they go to the OR. That's emergent, and they'll catch fire. So
that's completely understandable.
Yeah. So, I would think that you should be able to bridge the gap, that if it's a scheduled procedure and you know that patient has implants, or the patient has told you they have implants, then you should seek out what's the best way to, especially if someone's invested a lot of money into these implants, then you should at least make an effort to make sure that it's done properly, so that if it's an option to put them back where they're supposed to go, that you could do that. So
while we're still on the topic of piercings, James must be having some issues.
James popping in now.
Yep. So Sonya, you can answer this one too, because you have quite an extensive experience level with piercings and modifications as well. What if someone has and actually, let's take a step back. Will you explain what a dermal is for people, please?
It's a little teeny piece of metal, but anyways, it has a little foot on it with a post, and it goes probably about 3 millimeters underneath your skin, and the post sticks out, and then the skin heals around it, and you put a gem on the top, or any other thing. That's a normal one that everybody gets.
So how hard are those to remove?
They're not. You kind of make it like a little teeny cut next to the post, and then you grab it and you kind of twist it out. It's really not that hard to take out.
Have you had problems getting them out in the past? Because a lot of people would look at that, I'm assuming, in the ER and go, oh my God, I don't even know where to start with this. Do you unscrew the gem first and then make a small incision and pull it out?
Well, you don't have to unscrew the gem, because sometimes the gems even get stuck, and then you're just going to have a harder time. Like, all you do is grab the post, and then you lift it up to the side a little bit, and you make a little teeny slit next to the post, wherever you can feel the feet underneath. And then wherever the foot is, you make that little teeny cut, and then you kind of pull it out a little bit. It's only connected usually in 1 or 2 to 3 little spots. And as long as you can get those disconnected, then you're fine. Out of all the ones that I removed, I've only had a problem with 2, and that was because the girls were swelling really bad, and it was sucking back into their skin. So we had to, it took a little bit more to take out. We had to take off the gem and then screw a little post in there and then try to find it. But it's still not that bad. It only takes at the very most 5 minutes, at the very least a minute to get out.
Okay. While James is trying to figure out how to get back in here, let's talk a little bit about tattoo inks. There are always discussions about, we saw the legislation that they were trying to push through, I think in New York, about single use.
Yeah.
So you walk into a tattoo shop.
Actually, that actually did get pushed through. I'm following the petition on that right now. It did get passed as a law, and the girl that's trying, or the people out in New York that have band together trying to get the wording different, are working on that right now, but it's actually a thing out in New York. let me back up and correct me if I'm wrong.
Was it New York City or New York State? Had to have been state.
And it had to have been state, because usually that's where they start first.
So they are pushing through single-use inks right
ink
now.
Shots.
With shots of ink.
Ink shots.
So Sonya, how many different colors of ink do you have on your wall? I wish we had a picture to show people.
Oh man, I'm a color artist, so I have almost every single color that I can possibly get. I have at least maybe 200 colors, maybe. It's just like a painting kit. Well, not really a kit, but my collection of paints, every single color. A lot of artists maybe have 10 if they're more traditional, and then color artists have almost every single color you can possibly get.
So what New York is trying to do is they're trying to make it, or they have made it mandatory for the artists to have single serving ink colors, which would be very cost prohibitive. And that's for infection issues. But you guys essentially use sterile technique for everything.
Yeah.
Or clean technique. So, hi, James.
I am back. That was a tough one. I went somewhere and I couldn't come back.
So we're just to catch you up, we're talking about ink, and I've got a couple more questions for you too about different things as well. So Sonya, do you have issues with ink allergies, and what do they look like?
Yes, I've had a couple in the past, 10, 15, or however long. How old am I? 34, 14 years. In the past 14 years, I've had a very low amount of people that actually were allergic to the ink, and it's usually red, or any ink that has its base color is red. So if it's purple or magenta, if it has a red base to it, then they are usually allergic. But the ones that I've been really concerned about was specifically red ink. And what it looks like is it kind of bubbles up a little bit and looks like a blister, and it never heals, and it's only on that one color. And usually what the skin does is it just pushes it out, and that's usually what the blistering kind of stuff is. It pushes the ink out, and then once the ink is out, then your skin is fine. And that's usually what happens. It takes maybe a month or so. But I've had one case where she just was not getting better. The ink would not reject, and it started actually like developing more hives all over her body. And she went to the doctors. They couldn't figure it out. She went to the dermatologist. They couldn't figure it out. And so she finally went to, I think it was Michigan State, what place is that where it's like the educational one, so they could try to figure it out. Oh, what hospital was that? I think it was Michigan State. I'm not sure. Anyways, she went there, and they finally figured it out that she had a severe allergy reaction to that ink, and she actually had to go get it cut out and then skin graft. And that was the only time that I've ever seen it. And right after they skin grafted it, which is really funny that they left the feet on the owl just because it was black ink, and she was fine with that. But they took out everything else. So she only has two little teeny feet of an owl on her arm with a skin graft. But she was the only one that I've ever seen.
Yeah, another example of someone, healthcare field not
and that
approaching
one,
the art as something legitimate.
Yeah, and like that actually quite upset me too, because that one, she has 4 other tattoos without red ink, and they're completely fine. And right underneath the owl, where it was 3 inks that used red, every single color, it was orange, red, kind of like a cranberry kind of color. Anyways, every single one that had red in it, that's every single spot that had to come out. So they cut out the whole thing, and then underneath it had a word. So they left the word, and right above the word, there's 2 little teeny feet. Like, why couldn't they go another 1/4 inch? So anyways, I tease her. Yeah. I tease her every single time she comes in and talks to me.
So, James, could you give us a brief rundown of the different, you're obviously, you carry a lot of metal with you. What are some of the things that we should keep in mind when we're trying to remove jewelry in an emergency situation?
Like, quickly, don't cut it out.
Pull hard.
Yeah. Well, and use leverage. Like, I've actually tried to teach nurses and
like a Band-Aid, quick and fast.
Quick. I'm thinking about the nipples again. Oh, don't rip them out. Nice.
So, you know what? It only took 30 minutes.
Exactly.
30 minutes. So
jewelry, every piece of jewelry has a way to come out. Captive beads, literally, if you just pull the bead out, you have how it comes out.
Okay, so for people in the audience that don't know what a captive bead is, it is a hoop earring or a hoop piercing that has a small bead in it, and that bead is kept in place by pressure. So you simply take the ring, open it up. I've done it with a pair of hemostats.
I think
getting visual
I'm pretty
aids.
sure that we are getting so. So for those of you who are listening to this, James has stepped away from the camera to see if he can actually give us a visual of what he's referring to and describe.
Got stuff laying around.
Oh, there we go.
There it is. So a ring with a bead in it.
It's got one bead.
You know, you lined that up perfectly with your eye when you did that, right? You perfectly went like that. No. Okay.
So those, a pair of hemostats, and you can get those out pretty quickly. So let's talk about some of the more common ones. What about some nose rings?
Nose rings are either going to be push pins where you can just pull them apart. If you have a ring in it, it's still going to be a captive bead ring. Also, you have nose screws and L bends, which are, if you just navigate them through the bends, they'll be removed. You have to make sure snot is off or crusties, because that hurts like hell when you pull those through. So clean your crusties. So if you have people that are like a little smelly, you plug that.
Is that a technical term? Crusty?
Yeah, crusty.
All right, so
Sonya knows exactly. Actually, so do I. Sean, I think you're the only one here who hasn't had their nose pierced.
No. I have a singular earlobe piercing.
Well, your ears.
Take that back. When I was in college, I got the top of my ear pierced. That didn't last very long though. So
That hurts.
as far as it goes. So here's a question for you: as someone like myself who takes care of a patient who shows up with all of these piercings, and I don't know one from the other. They could all mean the same, or they could all be different. How does someone like myself or the bedside nurse go about figuring out what's what and how to get it out safely?
Well, what I've offered to some of the local area hospitals, and I've never been taken up on it, was actually coming in and training you how to remove pieces of jewelry.
High five to you, because I've done that at my studio too. And one person actually came in, and it was a cop that goes into where the juvenile place. Like they go in there, and I gave him all the tools and showed him how to do it. And now he can actually take out their jewelry the right way. Yeah,
and that's the best
that's awesome.
way.
Yeah,
that is what should be setting a standard for training, because you're seeing it all over the place, and it needs to be done. And I've made how many hospital calls because I have a friend or somebody, a client, and they're like, "Yeah, this needs to come out. Call my piercer." And so I'm running down the frickin' hospital. Whereas you have autoclaves, you can sterilize the tools, you can be taught safely how to get almost every piece of jewelry out, except I would say surface piercings.
All right.
So
I Sean, to me, this is a whole nother place where we could do, we could set up an online education.
Yeah, you could use a
Full
lab
track
to do
for
that.
this.
That'd be
we
interesting.
can teach you how to take out pieces of jewelry and show you tools, and that would be very easy.
I mean, I'll be honest. I work in a level 1 trauma unit right now, and I mean, by the time I see them, they're already out of the trauma bay. But my population, at least where I live, there's not a lot of body piercings where I live. Where I came from did though, so that's interesting.
Yeah. So Sonya, Mike's in the chat room.
I saw that.
Yeah. So he said airway.
Yeah.
For me, that means what kind of piercings in and around the mouth? Because we're always worried about, the first thing we worry about is, are they breathing? So what kind of things in and around the mouth do we need to worry about?
Are you asking me that one or James?
Either of you. Either of you.
You can go ahead, James.
What do you mean worry about? Like
tongue piercings, lips. What are the more common? Like tongue piercings are usually threaded, correct?
Yep. And you would just unscrew the beads. Be careful you're not dropping beads down people's throats.
The whole point.
Yeah.
The whole point of the question is that the tools that we use to intubate patients, there's a metal blade that goes along their tongue, and
Nice.
The little bit I know about tongue piercings is that, the pin screws.
Exactly.
So that top has come off many a times in emergent situations. So
gloves, 2 pieces of gauze, and unscrew it and just pop it out. Lip piercings are going to have a flat back on the inside and a bead on the outside, either screws on or snaps. And those are going to be the most 2 common that you're going to find.
Okay.
Do you guys ever see the webbing ones, or would those get in the way? Yeah, that
underneath.
And then
I don't think I've ever seen one.
Up here.
Honestly, no. I don't think we most of you guys are bad.
It's all bad.
It took 36 minutes. 36 minutes for this.
We were really good for a while.
It was.
Yes, you have. You have. All right.
What's bad is that we're supposed to transition into this whole, healthcare workers having these things. So we're supposed to even make it more professional, and you guys are just sliding down the slope.
All right. So between the two of you, can you think of anything else you would, or do you see anything else in your practices that healthcare providers either screw up, don't know about, pet peeve of yours that you would like us to, like to talk about and or address and or, we've got some people talking about online education as well. What are things that should be at least in part of our awareness?
I don't know about you, James, with this one, but I think that if a client goes in worried that their piercing is infected, but it's just going through the normal healing process, and the doctor tells them, or the nurse tells them to heal it out a different way, and then it usually gets really irritated. And then if it gets irritated, then they tell them to take it out rather than trying to actually heal it. I've seen that a lot with belly buttons, and very, very specifically where they take it out and it actually did get infected. And then they have that little pocket of an infection inside there, and then they have to go get antibiotics just because the nurse didn't tell them to do it the right way. And, they didn't want to talk to their piercer.
Yeah, you shouldn't use antibiotics for a piercing. Save it for the good stuff.
So what do you suggest if we have somebody come into the ER?
Not to tell them to use peroxide.
Ooh.
Damn.
Please, there are healthcare providers saying
use Mercurochrome. We still have that. We still use that.
I've heard that twice now. I've heard that twice now in the past 5 years. And so, of course, they came back. And one thing is, if it looks really irritated, obviously, it's probably they just either need plastic in there, or they need a better quality metal, or they need titanium. Whatever it is, they might be allergic to whatever they have. And the nurses or doctors don't tell them that beforehand, that it's an easy fix. All they do is try to take it out, and then it closes up.
Most issues that I see in the piercing are for people touching it with dirty hands.
Yeah, so that's another one too.
You're giving an infection to yourself, or you have a piece of jewelry that is either too tight or the person is bumping it too much. So now you have an agitation issue.
Yep.
Some of the things are really easy to heal, and you got to diagnose it the right way. Although I'm a piercer, I'm not a doctor. I can't diagnose. I can suggest my ass off, though.
Yeah.
Well, and then from the flip side, we are healthcare providers. We are not piercers. We are not tattoo artists. So this is something that we do not see as often as you guys do.
Together, yo.
Yeah.
Exactly. Well, exactly. And that's
love it.
And that's why I needed you guys to both be on here, because there are so many things that we just don't do the right way. And it's because it's not our area of expertise.
Mm-hmm.
I usually don't usually have a problem with tattoos. It's usually when people come in and talk about piercings, but I don't really deal with that too much anymore now that I've trained Janae. So, but yeah.
I'm trying to get more people to talk to their doctors and have them directly talk to me. Just be like, here, talk to my piercer.
That's actually a really good suggestion too.
Yeah.
And that way it's like, if anything comes up and there's an issue, now the doctor can talk to me directly. I can tell them what's in their body, and then I can tell them, we can talk about the protocols on what to take for that. I had it happen with a nipple piercing this week. So, and no doctors have contacted me yet, but I'm trying to to see what can happen with this. If, hey, here, give him my card, have him call me.
Interesting.
I think the key to that relationship is the patient.
Mm-hmm. I think you might be right.
I don't think, I hate to say it, but I know for a fact that if you approach the physician directly, that they probably won't listen to anything you have to say. But if you have the patient approach the physician or the provider, that the patient is requesting that for their care, then they can't refuse that, and they have to at least address it.
Yep. And I think most of my clients are approaching the nurses, and the nurses are trained what to do. They're like, hey, take jewelry out. This is what the doctor said. So you can't go against that. So I understand it, and liability is there for everything. There's a way around this. It's going to take a lot of work, and it's going to take everybody doing it, or
well, and it takes a lot of education, and it takes a lot of, we speak in the healthcare field about acceptance, and, we have to have cultural sensitivity and hold hands and sing Kumbaya and all that other bullshit. But we don't do it in a lot of ways. Like, for example, I had a trauma patient probably 10 years ago that the nurses didn't want to give pain medication to because he was completely tattooed. He was a tattoo artist. And for some reason, that nurse did not want to give pain medication because she just assumed he was a drug addict. So that really kind of helps me segue into the assumptions that people have because of the way we look. I wear a flight suit for a living. Most of the time, people don't see all my tattoos. But yet, I know that preconceived notions are out there. Sonya, I know you've dealt with this a lot lately. And Sonya's beautiful artwork that she has on her neck.
It
and
is
her
wicked. I love that.
Thanks.
I unfortunately keep staring at it. So.
Here.
That's wicked. Not only is it beautiful, but all I could think about is like the needle doing this on my neck. I'm like, no, I couldn't do that. I couldn't do that. So gorgeous.
So
thanks.
So, and James, you obviously, I'm sure, have had people say or do stuff to you as well. Is that very common? Where they just have preconceived notions when they first start talking to you?
Oh, yeah. Yeah, most people, when they meet me, they're like, dude, I did not know he would be so nice. I was afraid of him. Dude, he's like the nicest guy in the world. So, yeah, that is always very common.
Sonya, what about you?
Apparently, I can never have a job again because I have my neck done now.
Oh, I'm going away again.
Well, that's like didn't you share that, Em? There was an article. There was a phone interview.
Oh. Yeah, there was an article that we had saved. Sean and I keep a pile of interesting articles. And one of them was about a woman who had done a phone interview, was hired for a job,
it was
like
retail.
immediately.
It was like a retail job.
Yep.
I can't remember what though.
And they sent her their uniform policy, and one of them was there should be no visible tattoos, and they fired her. And it was simply about the tattoo policy. So one of the things we talk about a lot, I was getting my eyes checked the other day, and one of the techs asked me, wow, you're a nurse and you have all those tattoos and they don't say anything? And apparently, small town eye doctor, they had just had this huge conversation about visible tattoos. So Sonya, what's some of the advice you give your clients when they come in asking for tattoos on their hands, face, neck?
I just, unfortunately, because of the way the society still is, at first I look to see how many tattoos they have. And if they're fully covered, in a lot of areas, then I really don't question them because they obviously know how it goes. If they don't have any tattoos, I highly, strongly recommend them not getting it, and especially if they're younger, until they figure out what their career actually is going to be. Because obviously, young people just go through careers or jobs, and you don't know if somebody's going to reject you just because your tattoos. Unfortunately, it's a bad thing right now, but you have to think about that. And I'm 34 and I just got this done. There's no way in hell I would have got this done when I was younger. I didn't have hardly any tattoos until I turned 27, just because I was going through school and I wanted to make sure that I was employable. which is stupid. It's really stupid that you have to do that, but you have to still think about your future.
And you and I even had that conversation when we were doing my hand.
Mm-hmm. I did.
And we actually even pulled it back from how far you wanted to go down my hand because of that very reason.
Yep. Yeah.
So, and I think tattoo, and being former Army as well, the tattoo policies in the military have changed back and forth.
They do. They go back and forth all the time.
Boggles my mind.
I hear about it from my. Usually, my Army guys tell me what the new and regulations about tattoos. That's just stupid. I don't understand it.
I mean, where I work, there's still. I think there's no. It's not where I work. It's the schools around the area. Nursing students have to cover up tattoos that are anything that's exposed in the sleeves.
I had to do that in school too. I couldn't even have colored hair my senior year. I asked my teacher if I could, and because I was doing an internship, I couldn't have it.
I have a unique perspective on it because I liken it to the fact that I have no hair, and that when I started shaving my head, however long ago that was, it was a very shocking experience for many people, especially the older generation. You know, before the WWF came out and before the African American men started shaving their head on the regular, this was a skinhead, and this was bad.
Yeah.
So and I'm also tattooed, not tattooed to the degree that you guys are, but so it's amazing to me how the preconceived notions of what someone is who's tattooed, because when we talk about this conversation and I'm at work and people say, oh, well, you wouldn't know, you don't have tattoos. And I go, I'm sorry, what were you saying? And then well, you don't look like someone that would have a tattoo. Really? What does that look like?
Yeah, exactly. What does that look like?
What does that look like? So I think it's a generation gap, but it's also where a product of your environment. Mm-hmm. So the problem with it is that as a nurse practitioner, my patient's perception is their reality, and I can't change that. So even though I know the care I give my patients isn't affected by the ink on my skin, how they view me is different.
Yeah, but the only way to change the views of how people look at you is if you are who you are, you dress and act the way that you are with your uniform on, and whether your tattoos or piercings are showing, no matter what, you still give them the amount of care that you should be giving them, and you're still kind and courteous to them too. So if you keep on doing that over and over again, eventually they're going to figure out that it's okay. It's that these don't change the way that people are. So
I'll let Emily talk about it. It's not that easy because unfortunately we're in the role we have, healthcare is driven by opinions these days. So we have things called the Press-Ganey scores, which are solely based on if a patient liked you or not. And if a patient doesn't like you simply because of the tattoo on your skin, not because of the care you gave, you will get lower marks, and then you will lose money, basically.
So, okay, wait. What happens if somebody doesn't like gingers and they don't like your red beard?
You're right. You're absolutely right.
So what do? Do you dye your beard red?
Right. You're absolutely right. So it's a horrible reality, but that's the world that I live in right now, is that my tattoos, thankfully, are not, when I wear my uniform, they're not exposed in any way. So, but on the flip side of that, I talk to my family and my wife every day about when I'm getting my sleeve. So,
Sean, you are going to come up to Michigan. You are going to go on a tandem jump with my husband. You are going to go see James, get a nipple pierced, and Sonny will do your tattoo.
No. I don't even touch my own nipples.
Oh, too much information.
No. Tattoo, yes. Jumping, yes. Piercings, we're going to have to leave that one.
Saving out for the PA.
How many viewers did we just lose from my oversharing there? Anyway.
No, you got a bunch of hand claps. It's good.
Yeah. I never said I wouldn't be transparent. I mean, that's so.
So, I've been fairly fortunate in my world. When I was working orthopedics and worked essentially after hours urgent care, a lot of times my tattoos became a bonding topic with my patients. They would ask me about them. I would have children that loved them because it's, I have fish. So they would come and ask me about them and talk to me about it. And it was almost like I went from being a provider, somebody in this more authoritative kind of position, to a person. And that's one of the things that I like about it. And I know that that's not always the case. But I've been fortunate that, the only people in my real world job that have, had any issue with it has been management. And even management has been very accepting of me and, my crazy hair. And I toe the line, and I've gone across it a couple of times. But,
so what happens if your patients actually don't really care that you have tattoos, other than the 1% of people, but the only people that do care is management and the people above you? So how do you change that?
And that is something that I'm gonna even quote this article. I'm gonna pull it up. This was in International Business Times, U.S. Army Tattoo Policy 2015, military relaxes rules and regulations. In here, it says the Army Chief of Staff was quoted as saying, "As society is changing its view of tattoos, and we have to change along with that. It makes sense. Soldiers have grown up in an era where tattoos are much more acceptable, and we have to change along with that." Coming from that high of a place, I think that's pretty profound, especially in an organization that has influence that trickles down in a lot of different areas. As far as the military is concerned, piercings are a safety issue.
Yeah.
There are certain, obviously reasons that I wouldn't, as a nurse and as a transport nurse specifically, my ears are gauged, but they're gauged to a 00, which is 9-10 millimeters. So it's not that big. So I don't, James.
Yo, I got gauges, yo.
What are baby gauges?
We really need to bring back the coin stretching or stretched lobes. These sweet gauges, it's so old. Nice gauges, bro. Sorry.
All right, I'm the girl.
Oh, man.
Oh, yeah.
So I think it has everything to do with a horrible stereotype. It really does. And it's getting better. It's getting better, but it has a long way to go. I think that it boils down to that the generation is slowly changing. That when, 20 years ago, when I got my first tattoos and bald heads and sleeves were viewed very differently than they are nowadays. And it's because of my generation growing up and my generation being in charge now. So it is changing. It's just going to take I'm probably going to say another change in generation before it'll trickle into the corporate world. I really do believe that it's slowly already changing because, you don't I have employees that I work with that have sleeves, and they don't have to wear long sleeves. Their tattoos are exposed because they're an employee in the hospital. But the students who are in school still have to wear sleeves. So it's happening. It's baby steps.
Well, and I think it's going to take more exposure to people like the two of you, Sonya and James, who, you both run your own businesses. You're both very successful in what you do and have worked extremely hard to get to that point. and you have the training, the expertise, and the willingness to educate behind you. And until we as healthcare providers poke our heads up out of the sand and say, oh, hey, maybe we should ask the expert some questions, until we can break that barrier and figure out how to break that barrier, that's not going to change. But I think it's your willingness to do things like this tonight that will help that in the long run.
I foresee both of you becoming another, what we call in the hospital, an ancillary service, because we have ancillary services that didn't exist 10 years ago because there was no need for them, or there wasn't as much of a need for them. And now we have other ancillary services in the hospital that were created because of the change in our society. And I predict, maybe not in the near future, but in the future, that both of you are going to become ancillary services for like what we call consults. Is that when you have someone who has the piercings or has the tattoos and they're going for a surgical procedure, or they're having something done in the hospital and they're in for an infection, take your pick, and they're going to consult you for your expertise.
That'd be cool.
I completely
You can also, as healthcare providers, there is the Association of Professional Piercers holds an annual seminar in Vegas. You can go to that for free, and the classes are waived because you're a healthcare professional. We've been wanting to work with you. And so...
Hey, Emily, I'm doing a show there.
I'm in.
Come out with me in September.
Oh, Lord.
All right, Em, you're at your hour. What do you got left?
All right. Thank you both so much. I know it was a technical challenge to get you both on here, and I'm just grateful that you were willing to take the time. And we, I'm going to speak for Sean, but we both love to have you back. Oh, yeah. I think there's so many things that we could do and educate and help to, spread the word and giving better care for our patients on so many different levels. Because being part of both of your worlds, I would be really pissed off if somebody screwed up my tattoos and or lost my really expensive jewelry because they either didn't know how to take it out or, did more damage to my body in doing so. So without your willingness to continue to educate us, nothing would change. So thank you both very, very much.
I appreciate it because
thank you guys.
You have definitely educated me this evening. So in more ways than one. off record and on record. But
I just imagine sleep tonight.
Yeah. You definitely have given me pause for when I do take care of patients who have the tattoos, because I work in surgery. And for those patients that do have the implants, I'm going to at least have a pause and think twice about it, because they've invested that time and money into that art, that I shouldn't neglect it. So I thank you for that.
Thank you.
Yeah,
that's cool.
That's awesome. Any parting words from either of you guys? Any more jabs at my gauges, James?
No, that was just cute. I can't leave it alone sometimes. I try. I really try.
If I wasn't getting picked on, I think something was wrong.
That just means I like you.
Yep. Yeah. All the way around.
Yep. Well, thank you both. For our listeners who are not hearing this real time, we will have information for both Sonya and James in our show notes on the website. We are always available to you on Twitter. Our Twitter handle, Sean?
Ask the Cause. Oh, Sonya has something. Go ahead.
Do you want those pictures of what that really bad allergic reaction looked like with the skin graft?
If you have permission for us to use them, absolutely. Yep. We'd love to add that stuff.
She gave them to me to be able to educate other people on what looks like. So I can definitely share them.
Can you put that up on the blog post?
That would be awesome.
Yeah,
okay.
Put it in the blog post.
Thank you. Okay.
To answer your question, Em, yes, we have a Twitter handle. It's at Ask the Cost, ASKTHECOS, as in change of shift. We're also on Facebook, The Change of Shift. We're on Google Plus as well as YouTube. Once again, The Change of Shift. I'm just letting.
We're all over the place, Sean. You're doing fine. Keep going.
Go ahead.
You're so professional. I love it.
Go for it.
So, Sonya and James, where are you at on the interwebs?
I'm on Instagram and Facebook. You can get a hold of me both ways if you want to ask any other questions. And it's just my first and my last name. Super easy to find.
Awesome.
Yeah,
James?
face crack, Insta crack, anything holy body. Look up. It's all there.
And we'll make sure that you guys have all that information in the show notes as well. Thank you both very, very much.
Mm-hmm.
And stick around for the post show. Sean,
As always,
what's the first thing we do in an emergency?
check your own pulse first.
Check your own pulse first. Thanks, guys.